right, we're just getting ready for another episode of Longevanity while we wait here for our streaming software to go live. There we go. Let me just see here. Go live. There we are. We are now ready to go. So let me just get this all shifted over. All right, I can take these off now because I don't need them anymore. So thank you so much for joining us here today. My name is Amber Bocknek. I'm a physician practicing in Ontario, Canada. And you are now watching Longevanity, where we focus on the intersection between lifestyle, health, wellness, living your best life, looking younger, feeling better, and so on. So we touch base on a lot of different topics here, but before we dive into today's content, I just want everybody to be reminded that this is really an educational podcast only. The goal of today is to stimulate some interesting thought processes, questions, and the real purpose is to help you have something to talk about, to advocate for yourself at your next primary care visit. So please do not act on anything directly without consulting your own primary care provider. And with that said, we will get started with today. So I look funny today. I can actually see it on the playback I have here with my streaming software. Before we get started, I just want to point out that nothing bad has happened to me, except myself. I have a class reunion coming up shortly, and so I thought, I'm going to do a little work. So I have done some CO2 laser on my face and on my neck and chest. So no, nobody is beating me. This is CO2 laser, and I will look a lot more normal in about a week's time. So anyways, that's not what today is about. I want to talk about a fascinating podcast that I personally was listening to this morning. So if you're looking for some great educational content, I want to give a shout out today to the Dutch podcast. They focus a lot on functional health issues, particularly around women's health. So again, today I want to talk about the guests that I heard on there and some of the really cutting edge, fascinating information that's coming out in and around hormone health, metabolic health, and again, how to be your own best advocate. And it really caught my attention today. Again, we all have our personal history that we bring to the table to these sorts of things. And for those of you who might not be aware, I personally had breast cancer about 7 or 8 years ago now. So concepts and topics and current literature around breast health, cancer survivorship, and hormones is, of course, very interesting to me. So I saw that topic pop up in my inbox, and I'm like, I want to have a little listen to this. So this morning on my commute in, I dialed it up and had a wee listen. And again, it's really echoing a lot of what we know to be the new facts around hormones going forward. So today I'm going to talk a little bit about some of the controversy and fear around particularly menopause hormones. But we're going to talk a lot more about that. Menopause hormones are part of a bigger picture that involves metabolic health. And again, the relationship between metabolic and health and hormone health are actually different sides of the same equation. It's like talking about a teeter-totter. It's all connected. You can't have one side without the other. So today we're going to look at hormones in context of metabolic health. And also part of that, I guess it's a three-sided teeter-totter, maybe that's not the best analogy, is to also look at inflammation and the role that that plays. So that's where we're going to get to. So hold on tight. We're in for a bit of a ride. So let's kind of start with where we're at right now as far as concepts in earthquake, in preventative health. So conventional medicine terms screening tests that we do as preventative health. So again, I think in many situations, we're having conversations about definitions and context. So if you've been watching some of the things I've been talking about for a while, one of the things we've been chatting about here on the podcast is the difference in the meaning of the words normal lab values and optimal lab values and why the definitions are important. So let's start there first. So normal lab values are primarily where the population fits in. Normal lab values are ascertained on basically healthy adults between the ages of 18 to about 65, and so most of our reference standards are based around that with very few exceptions. And normal is pretty much the 95th percent of people. So if you think back, way back to statistics, and hopefully that's not evoking PTSD for some of you, it does for me, but you may remember bell curves. And so the median falls directly in the middle of the bell curve with 2 standard deviations on either side. So in English speak, that means if you're in the bottom 2.5% of the population or the top 2.5% of the population, you are not normal, just by definition. If you're at like 2.6% all the way up to 94.9%, you are normal. Now, if you were someone who was cruising through life, let's say at the 90th percentile, something happens and your body changes, and now you're at the 10th percentile. Your labs legit may come back saying you're completely normal, but you personally may feel anything but normal. And what's important to note is that normal values are not necessarily sensitive enough to know what feels good for you or what is normal for you. So you have to view these things with that in mind. And this is where the concept of optimal comes up. So optimal doesn't necessarily mean the highest. There are sweet spots for some of these things. So in some situations, the optimal value might be in the, let's say, the upper quartile, the top 20 to 25% of the range. Conversely, sometimes it's at the bottom 20 or 25% of the range. There's some things we want low, there's some things we want higher. And some things are just like the story of Goldilocks and the 3 bears. We want the porridge to be just right in the middle. So optimal is what is very important, and also change for you. So your lab values may have significantly changed over time, and that may be reflected in what you're feeling. But when you go for testing, conventional medicine will say you're normal. Again, it is normal by definition, but it may not be normal for how you feel. And it doesn't delegitimize what you're experiencing. It just means we don't have a sensitive way to capture it. In the same way that normal and optimal are different ways to look at lab values, we have different ways to look at preventative health. So the way conventional medicine looks at preventative health is something I think is more appropriately termed early detection. So a lot of our preventative health tests are actually not preventing disease, but we're looking for it in an earlier form. The disease is already there. We haven't prevented it. We've caught it, but we've hopefully caught it early. Let me give you a few examples. So for example, colonoscopy. Colonoscopy is hopefully to find nothing. But the goal is, if there's something brewing, we would prefer early detection, because early detection leads to different outcomes. So again, you can think of it, in some ways it's preventative, but if the colon cancer is already there, it's already there, and we're simply detecting it early, which again is a good thing. But wouldn't it be better if there were things we could do to try to help our bodies not get there? Likewise, cervical cancer screening. Cervical cancer screening saves many women's lives, but it's another example of early detection. The problem is already happening. We haven't prevented it. We've caught it early, which has many benefits from it. But wouldn't it be better to try to be a healthier individual? Hopefully, if there were things we could do to modify our risk and reduce our risk of getting it in the first place. In the same category again, breast cancer screening. Early detection is really what it is. It's looking for tumors that are already there, but it is not an intervention to try to prevent that. So again, it has a place, but wouldn't it be interesting, or again, shouldn't we be having the discussion or trying to explore ways to actually truly prevent it? Early detection is a logical, thoughtful, well done downstream intervention. Downstream in that the problem has already occurred. At this point, we can't change that, but we sure as anything want to be all on top of it and manage it appropriately. There's concept now around trying to be intervening before the development of absolute cancers. So what can we do to make ourselves healthier to try to prevent them from happening in the first place? And this is really an area of very interesting, both pragmatic and sort of theoretical discussion. So let's talk about that a little bit. So why do we get cancers? Well, first of all, let's talk a little bit about what they are. So the body has many cells, many different cell types, And the cells rejuvenate and replace themselves many times over our lifespan. And in the process, the cells are dividing and replicating, and the DNA, the genetic material in the nucleus of each cell, needs to be able to copy itself accurately, and then with the replicated copies, the cell divides to make new cells and replace the ones that are aging or damaged. This is a complex action. There are so many little things that have to happen in order to copy that DNA correctly. If the DNA is not copied correctly, then the daughter cells have abnormalities in them, and that can sometimes lead to not being able to regulate itself correctly, and then it loses its ability to control its growth, and it replicates and replicates and replicates more and more of its own dysfunctional kind. And that's basically a very simplified version of what a tumor is. Now, these cells are dividing all the time in our body, all over the place. And it may be a little unnerving to know that on multiple occasions there are mistakes made in copying the DNA. Now, this is not all doom and gloom. The good news is a healthy immune system, frequently, many times over the course of our lives, will detect abnormal duplications, and it will activate the immune process to kill that cell. So, in essence, we make little cancer cells or abnormal cells, not infrequently, but with a healthy immune system. Oftentimes our body will find them and destroy them before they have the opportunity to replicate themselves and become a tumor. So the question is, well, what types of situations invite or support or foster the ability of these cancer cells to evade detection and be able to replicate? And here the answer is actually complicated. So the take-home message is there is no one specific thing you need to do. It's actually many, many variables. It's multifactorial. People get cancers for multiple reasons. Sometimes they have some genetic predisposition, and sometimes it's environmental, but often it's a combination of things. So there are different things in our lifestyle, in our world, that increase the risk of having abnormal cell replication resulting in cancer. And again, some of these things we can modify and some of these things we can't. So what are some of the known things that play a role here? Well, sleep. Interestingly, sleep is the time when our body works to heal itself and regenerate from the day. Regular sleep cycles and trying to promote a healthy sleep habit is one of the best things you can do to try to help your body age in a healthy way going forward, and to provide it its best opportunity to, again, survey your system, look for abnormal things, clear them, and prevent problems from happening. So sleep is something we actually have to guard, value, and prioritize. And there's all sorts of wonderful information on the internet about how to do sleep hygiene and work on that. And we can actually talk about that just as a topic all of its own. But just know there are things out there that you can look to. And even though the list may seem overwhelming, if you don't sleep well, just picking one meaningful change you can make, perhaps off of one of these lists, just one, not everything, start with one, but if you can start there, that may be a gift to future use. So sleep is very important. But the main focus of this talk that I listened to today was really about the relationship, and this is where I want to spend some time, is talking about metabolic change and inflammation. Because these two topics are actually tightly interwoven and uniquely interwoven as well with the hormone story. So living creatures really, when you break it down fundamentally, are complex, walking, talking bags of biochemistry. We exist because we have chemical interactions between all of our cells that, when they work properly, allow us to have life, function, form, and continue with quality. But when some of our systems get disrupted, and the disruption can come from various points, it can come from inflammation, whether that's related to stress, cortisol, or disease. It can come from metabolic change, genetic tendency towards diabetes, or other changes that happen along life, or reduction in hormone levels that also can influence metabolism and the metabolic impact. But one of the big things they were talking about is that a major driver of chronic illness And again, this is not just cancers, but cancer, chronic disease, autoimmune conditions, cardiovascular disease, peripheral vascular disease, dementia, and the like. I'm sure there's others I didn't mention. Just because they're not mentioned doesn't mean they're there. But the main point is there's a lot of different diseases that are either triggered by inflammation, made worse by inflammation, and also impacted by metabolic things. So let's talk about that. But first, let's talk about, well, what do I mean by metabolic things? The first point of conversation, I think, is to have a glucose discussion. So glucose is one of the primary energies of the body. We need it to survive. You need to think of glucose, though, very much like a Goldilocks and the Three Bears kind of story. Again, you need that blood sugar, glucose being blood sugar, to be just right. There is definitely a sweet spot. Not too high, not too low. You need it right within range. And the body will work very hard to try to keep it there. When it becomes elevated, something that was helpful for us in the right range at high levels becomes very irritating. The cells do not like to be bathed in an environment with high blood sugar. What happens is they start to develop inflammation. And with that, they start to develop, like, for example, in the blood vessels, which are very much exposed to blood sugar levels, you start to get breakdown of the lining of the blood vessel, which again is a first starting point sometimes for the hardening of the arteries and the laying down of the fatty deposits in there, which ultimately can lead at the downstream part of the disease process, cardiovascular disease, heart attack, or if it goes towards the brain, destruction and obstruction of some of those little fine blood vessels that feed your brain. And I got to tell you, your brain does a lot better with oxygen than without. So again, you can have stroke processes, dementia, inflammation in the brain that can affect in other ways as well. So high blood sugars can do that. Again, you can get vascular damage in small fine blood vessels of the kidneys, of the eyes, all over the place. So high blood sugar is a major driver of a lot of different diseases, and it's probably one of our more important ones because the number one killer of human beings is still some form of cardiovascular disease, so it absolutely deserves mention and attention. So this does not happen overnight. It's a process from normal, healthy metabolic control to very, very unhealthy. And it's important to know different ways to look for early signs because this is one of those things where it's not an all or nothing phenomena. This is a slippery slope down a gradual hill. And the earlier we recognize it and the earlier we start to work on it, the better our long-term health will be. So some people think, again, the best way to look for this is just to have your blood sugar tested. Now, it is important to test your blood sugar. But that's only a little snapshot in time. Blood sugar, like for example, the same way a diabetic would poke their finger and look at their sugar in the moment, or if you go to the lab and you have your sugar tested when you're fasting overnight, only shows you what it is in the here and now. It doesn't give you a full comprehensive view, and blood sugar fluctuates widely. It's supposed to. It's supposed to go up after you eat, but within reason. And it's supposed to come down within a reasonable amount of speed as well. And so when you just do a single poke and check an immediate blood sugar, it only is a snapshot and it doesn't give you the full picture. Better is something called a hemoglobin A1C or HbA1c. Now that is an average blood sugar over approximately 3 months. How do we know that, or what are they doing? Well, that's an interesting blood test because what they're doing is they're measuring the amount of sugar that is on a red blood cell. A red blood cell has a lifespan of approximately 100 days or about 3 months. So you know the cereals the kids eat and Frosted Flakes? Well, what's the difference between a cornflake and a Frosted Flake? Well, the frosting. Basically, they're the same cereal, one with the frosty stuff and one without. So think of healthy red blood cells like cornflakes and high sugar environment exposed red blood cells as Frosted Flakes. So when we do a hemoglobin A1C, we're checking to see how much frosting you've got on your little red blood cells. If you're all frosted up like a Frosted Flake, your body is exposed to quite a bit of high blood sugar moments. Meanwhile, if your Frosted Flakes are cornflakes, there's very little sugar on those red blood cells. It means you have relatively good control. So a hemoglobin A1C is an earlier and perhaps more reliable way to check blood sugar over the long term versus the individual sugars, because you can get fooled with them. They can be down sometimes even when they are quite elevated. And I think this is also the rationale why people sometimes wear continuous glucose monitors even when they don't have diabetes, because they're concerned about this and they want to monitor. Now, the A1C is a good additive test to get a better understanding of your metabolic picture. But what if this actually starts even earlier? Well, the answer is, of course, this is a loaded question, is yes, it does start earlier. And where we can see it is, again, the body wants to stay in equilibrium. The body has systems to try to keep itself healthy. This is why, as a species, you have to remember all the time that we evolved as a species. And we had survival things programmed into us that other species didn't, which is why we exist today and other species don't. One of our survival things is our ability to manage our blood sugar. And our pancreas makes a very important hormone called insulin. And insulin is the hormone that's released after a meal to reduce blood sugar, and that's what helps to pull it down. So even before the blood sugar starts to climb, the body will really try to manage the higher sugars that it experiences because it's sensing them, and it will start to release increasing amounts of insulin. So one thing you may want to request, if you're concerned about your sugar, when you go in for your next checkup with your primary care provider, you could ask for a fasting blood sugar, a hemoglobin A1C, but more importantly, you might want to ask for a fasting insulin level. That will tell us, even before the hemoglobin A1C rises, and of course well before maybe the fasting blood sugar rises, that there is a lot of effort being put out there to keep that sugar down. That is one of our more sensitive tests right now to look for that. And if we see high fasting insulin, even with a relatively normal hemoglobin A1C or glucose, then already you're starting to have some issue. And if we really want to be preventative, if we really want to get on top of things, this is our best opportunity. Now, having said that, if you have issues, it's always a good time. We just wish we could go back in time, which we can't, and try to get started earlier. But for most sensitive looking, a fasting insulin is really important. So from there, again, we want to try to interrupt this inflammatory cycle. As again, the sugars go up, we have more whole body inflammation. And with inflammation going up, this can sometimes be a trigger for the immune system to not function as well and not survey the body as well. And also, again, a stimulus for some of the chronic disease we have. So these are important things. So now, bringing it back to the cancer picture. One of the things they were really talking about today was how metabolic issues can increase inflammation and interfere to a degree or be an added layer of immune dysfunction, which sometimes helps create or foster an environment where cancers can develop. Again, it doesn't just happen in a vacuum. Family history, other exposures, other illnesses, sleep deprivation, chronic stress, all of these things can be contributing factors. It's never one thing, it's often many things. But again, managing the metabolic discussion is very important. Hormones and menopause. When women start to go through perimenopause, in addition to having drop in hormones, they tend to have an increase in overall inflammatory changes that are happening. And so this can start some of this cycle here. And so this is where the GLP-1 inhibitors sometimes have a very important role, along with nutritional counseling, exercise and strength training, stress management, and sleep. GLP-1 inhibitors lately have been all over socials, and sometimes they are being slammed where they don't deserve such a bad rap. These are not vanity drugs, although some people do use them specifically for that inappropriately. These are very important critical metabolic medications, and they absolutely have a place at the table in the discussion of preventative health and wellness. Always, they should be done under the direct supervision of a care provider who is invested in your overall care, who knows you well, and is checking into the other things that are going on. They also should be done, they are not magic bullets, they need to be done with other healthy, supportive lifestyle maneuvers, which for many people, although not all, should be doing some degree of resistance training that is appropriate for them and where they are in their health trajectory, as well as a protein forward diet, again, depending on personal circumstances. And this is, again, where this is not meant to be specific medical advice for you, because certain health conditions, you have to be careful about protein loads, specifically people who have kidney problems, but there may be a few others. So again, please have these discussions, but do know that this is not blanket information for everyone. But managing the metabolic side of things is an equally important part in the hormone discussion and should be at the table with hormones. So again, hormone health is metabolic health. Metabolic health is hormone health. What about breast health? This is what caught my eye with this talk. So they were reviewing the Women's Health Initiative, and for a very long time, the last 20 years, there's almost been a prohibition, no hormones after breast cancer. That has pretty much been the dogma. That is now being very much revised. In 2026, this year in March, most interestingly, one of the American Journals of Oncology or Cancer Studies came up with an opinion paper that was talking about reevaluating our stance on hormones after cancer. So this is not when you're having cancer treatments, but for those of you who may be similar to me, who are now post-breast cancer, we have a history of it, but we're no longer being treated. This should be a personalized conversation. When we have gone back now and looked at the data, and these are the oncologists, the cancer doctors who are looking at the data, even back when the Women's Health Initiative study came out and was looking at estrogen, and they raised the concern about hormone therapy having an increased risk of breast cancer. They didn't break this down properly into its individual components. Retrospectively, we've gone back and critically analyzed the data. And what they actually found was, and this may come as a huge surprise, the women who were taking estrogen only, and again, this was not bioidentical estrogen, this was actually horse estrogen or conjugated equine estrogen, horse estrogen. And they were taking it by mouth, which again is something that we have different opinions on now versus then. But these women had a 23% reduction in breast cancer, 23% less breast cancer. When they looked at the progestins, they found that those women had an increased incidence. But again, definitions and words are very important. A progestin is a synthetic chemical that has some progesterone-like properties, but interestingly, progestins, the synthetic chemical, is not the same as progesterone, the human hormone. They're different, and they interact differently with the body, and they have different metabolites or breakdown products, also significant. So in the situation with a progestin, they found that it also had some estrogen stimulating properties. So although it was made to be a synthetic mimic of progesterone, it also had undesired additional properties where it stimulated the estrogen alpha receptor. Now, this might be getting a little bit complicated, so please bear with me if I'm overcomplicating this, but it's important to know that there are estrogen receptors all over our body, brain, skin, bone, muscle, all over. It's not just a breast and uterus hormone, it's a whole body human hormone. And there's different types of estrogen receptors. So there's alpha receptors and beta receptors. For example, the alpha receptors are highly stimulatory, where the beta ones have a different role. So the progestins, the synthetic non-human progestin mimic of progesterone, actually stimulated the estrogen alpha receptors. Again, more stimulation, uncontrolled stimulation. And what we know about general principles of natural human estrogen and progesterone is that natural human estrogen, I like analogies, so I think of it like a car, is like the gas, and progesterone is like the brakes. So they work together in synergy so that the car works properly. You have to have both. But estrogen is more stimulatory of growth when it comes to breast. And again, this is the concern with breast cancer. And progesterone is modifying, controlling, and applies the brakes. So again, it keeps things matured, appropriate, well-grown, and in balance. So it's very important to have this relationship between estrogen and progesterone, real progesterone that operates like progesterone. So one of the theories now, looking back at this women's health initiative using progestin, which is again sounds like progesterone, but it is not, had additional stimulating properties for breast, which is why the women in the study, they hypothesized, who were getting both estrogen and progestin, those women had the increased risk of breast cancer, not the estrogen only group. So there is now real reason to believe that, again, it may have more to do with the synthetic progestin creating this extra stimulation. The other thing about estrogen, progestins, and progesterone is if we look at these things are metabolized by the liver, and then they make little metabolites, and the metabolites also do things in the body. When it comes to progesterone, the human hormone, it makes allopregnanolone as a metabolite. Big word. What does that do? It crosses the blood-brain barrier, allows us to make GABA, a natural calming hormone that helps us to sleep, feel calm, feel, again, more like ourselves. Progestins do not make that. And so we don't get that benefit from it. So again, they're not a direct substitute. And again, they don't operate in the same way. So this whole conversation about, well, what really causes breast cancer and are hormones implicated is a very detailed and very complex conversation that needs to be individually had woman by woman, particularly women who have had breast cancer in the past. But the big thing to know is that the conversation is shifting. Where it used to be, oh my goodness, hormones are prohibited after breast cancer. Again, the American's Journal around Oncology is now saying it's a case-by-case basis. And again, for some women, it's not prohibited. In fact, actually, if the benefit and the overall quality of life enhancements are there, it may actually be recommended. So the good news is, if you've had a history, a complicated health history, similar to me, this is something that can be back on the table, but it definitely takes a detailed conversation. So with that said, we have covered a heck of a lot today. We've talked about metabolism, inflammation, production of cancer, how to prevent that, controversies in the Women's Health Initiative, and then more recently, the pendulum shift in post-breast cancer scenarios. So hopefully this has been an interesting journey, but again, there's lots of emerging things here, and these are not interactions that are intended to be taken without the advice of your personal care provider who knows you very well, your personal health history and your health journey. So if you have more questions about this, please do reach out to those who know your health the best and make sure you're doing the best things for yourself. So anyways, I hope you've had an interesting journey with me today. And if you have questions or you'd like to have more conversations about this, please feel free to message. If you've enjoyed our content, I would really love to have you on board with us. And I'd like to just give you here our Longevanity QR code so you can follow us. If you subscribe here, just take your phone. If you scan this now, this will bring you into our YouTube stream. All of these are actually recorded and available for follow-up watching on YouTube. So if you go to Dr. Amber Bocknek, go to the live area. That's where you'll find these. They're over there. If you want more information about what we do, whether it's my blotchy CO2 face or any of these hormone or other life and health span enriching programs, you can visit our website. We have it all on there, both the cosmetic things as well as the hormonal and some of our longevity practices and testing. And then also too, most recently, we have, I have a book. If you're really looking at hormone management and not really sure where to start or how you fit into the equation, if you're a perimenopausal gal or you're already well into the throes of it, this is a book called Hot Flash to Hot Bam, and it is a comfortable, casual walkthrough of important questions and considerations for you to discuss with your care provider. And there's a complimentary workbook that goes with it. The ebook is available on Amazon. I would make it free if I could, but unfortunately Amazon needs to get their little piece of the pie. So it's $1.99. But if you download the book, there is a free workbook that you can obtain. It's just a download, and it has a lot of exercises as well as some sort of sample talk points and scripts and preparatory tools to try to help you have an effective appointment with your family doc or your nurse practitioner, your OBGYN, whoever you go to get your care. Because sometimes being prepared is the difference between an appointment where you leave herd and feeling like you've got a plan versus one where you just feel kind of frustrated and not sure where to go. So let's try to set the stage for success. And so there's some tools there for you. So anyways, again, I just want to thank you all for watching and attending on your lunch hour. Hopefully all of you are having a great day. And whether it's now or later, I look forward to being chatting with you in the future. Thanks again for